Hi, Dr. Peter Montgomery, family practice doctor, here again to talk about COVID and again the 5 W's that we can do to stop the coronavirus, that we are all washing, waving, wiping surfaces, and whoa, not touching our face. Want to give an update on some good news. The FDA has approved for emergency use, the use of hydroxychloroquine and chloroquine for treating the COVID virus. I've talked about that in a previous video if you want to look at that. Again, how do you kill something that's not alive? Well, you can keep it from reproducing. And the medicine slows the reproduction of the virus. Also, zithromycin, an antibiotic, can augment that effect. It works by keeping bacterial cells from reproducing faster. It slows down gums up the works of the cell's mechanisms to reproduce. So again, keeping things from reproducing faster can help here in this situation. Following the philosophy of another similar dangerous drug, bacterial meningitis. There's a non-dangerous form called aseptic meningitis that's caused by virus and a bacterial version. And the bacterial one can kill you in 6 to 12 hours. So when someone comes in, you're suspecting it, the standard philosophy of treatment is treat now while you're waiting for the tests. We're having a similar problem with COVID, which is the tests are taking days to get back. Should we wait to treat? Well, now we have an emergency use drug protocol. Plus the Chinese were using this and they published data that the chloroquine was something that they used. So it's not experimental. There is evidence in some very limited trials that it can be helpful. So while waiting for test results, I think it'd be wise for clinicians to start treatment. Obviously, things we can do to prevent, not spreading it. Taking zinc every day helps your body fight off viruses. Taking vitamin D every day helps your body fight off viruses. Exercising on a regular basis, getting your body hot and get it warmed up increases your body's activity of its natural killer cells and monocyte cells that fight viruses before your antibodies are even produced. It helps your body make more antibodies when you are infected. So getting hot, even taking a hot shower, a hot bath, or a hot sauna can do that. In the Scandinavian countries way up north, Denmark, Norway, Sweden, and Finland, all the Nordic countries up there, are actually getting infected too. And the country that's doing the best is the Finnish. They have the least number of cases, the least number of cases per population, and by far the least number of deaths per population. And of the countries, they're really into the sauna more than the other ones. Matter of fact, there's like 5 million Finns and there's like 2 million saunas in the country. So they're really into this. So getting your body hot and then cold and then hot again has been proven to get your body's immune cells to fight better. They actually have less colds from doing this too in general, and it can help in this situation too. So either exercise to get your body hot, take a hot shower, anything else you can do. Again, there's a shortage of masks and equipment to try and protect yourself. I came up with this idea about a month ago, showed some photos of my family. Somebody else on the internet showed it today, so I thought I'd show something came up because I was afraid of masks running out. You can buy a snorkel online still. I got this one on Amazon.com. It was $25 and they run $25 to $50 depending on how fancy one. Usually there's a snorkel coming off the top. I popped that off and put an N95 on there and just duct taped it on there because, really high quality, but it gets the job done, makes a nice seal. When you put the mask on, you have a very complete seal. Nothing's getting in around this to get to you. Everything I breathe is coming in through the filter on the top, and you can sneeze and cough all over me. Nothing is getting at my eyes. I can't touch my face, so we're getting that achieved. It's doing a good job. I ran up and down the stairs a few times, and it worked really good. So this is a viable option. This can get dirty. It's not a one-use throwaway. You would need to wipe it down real good. Often that's not good enough. An ultraviolet light source can be used. You don't want to look at it, but you can set it up and leave it on there for 10 minutes. Usually they have a timer. Leave it in there for 10 minutes on the inside to clean the inside, another 10 minutes on the outside to clean the outside, after wiping it down for a little extra good clean overnight. Not a bad idea, also something you can get. So these devices are very good also for cleaning your bathroom or areas. They have a timer because you don't want to look at the ultraviolet light. It's not good for your cataract formation. When you hit the button, you have a 10-minute timer or 10-second timer correction to get out of the room and set it, but then it'll clean all the surfaces and kill viruses and bacteria very effectively. So another option for keeping your house clean. Not trying to sell products, just trying to show that there's other things you can do in addition to all the avoidance things. We're all in lockdown together, so everybody hang in there. Be the most excellent version of yourself with your health and your behaviors. Be excellent to each other, and we can get through this coronavirus attack, and we need to just keep it up. We're just quarantine all the way through April. Absolutely. Into May, some places are saying till June 1st, it's wisdom. It works. The problem is, how do we work? How do we make money? That's the hard part. You know, the economy's shut down. That's a tough, difficult situation. I have family members who have had jobs lost and patients that I've had to talk to about this. But this is much worse than a bad flu. A bad flu season, most flu seasons, about 30,000 people a year die. In the U.S., a horrible one would be 100,000. This one's going to be 100,000 at the best. Could be 200,000 if we haven't done what we've already done up to now. Could have easily been 1 million people. So I think we need to keep doing what we're doing and do even more, and just hang in there. It's a duration issue now, but keep doing all things you can do to keep yourself healthy, and I'll check back in with you again tomorrow. Hang in there, everybody.